Healthcare Information Technology Solutions for Healthcare Delivery Cloud. Team Presentation Group 2. Clouding is the delivery of hosted services over the Internet. It can be divided into two broad categories, either public or private. The primary objective of clouding is the computing in healthcare institution is the provision of scalable and easy to access computerized resources and information technology services. Benefits of the cloud. Clinical research. Through clouding, many pharmacology vendors have an opportunity to invest in research and drug development. Also, the cloud has led to development of pharma-specific clinical research with the aim of cutting the cost of development and manufacturing of new medicines. Electronic medical records. Doctors and hospitals have started in the adoption of cloud-based medical records and archiving for medical images through the cloud technology. The sole aim of this advancement is to relieve the hospital information technology departments of numerous duties and release them to handle other tasks, for example, adoption of electronic medical records and improving efficiency in clinical support systems. Collaboration solutions. This technology backs collaborations and teamwork in caregiving, and it necessitates the use of applications based on the business models and specifications and standard clinical information. Initial success has been realized in cloud-anchored physician partnerships. For instance, private video conferencing, doctor visits are being worked upon, and signals a positive result will be achieved. Diversifying such offerings to mobile facilities, for example, remote telehealth or response to disaster outbreaks, is being realized with smartphone adoption and broader wireless broadband use. Health information exchange. It has enabled healthcare entities to share information contained in mainly electronic health record systems. There is a significant potential that CIOs might accelerate the deployment of the HIE through a linkage to calculate cloud implementation. Telemedicine. Apart from the inclusion of telesurgeries and teleconsultation, health record exchange, home monitoring, and home conferencing has been adopted in healthcare through cloud computing technology. External factors that affect the cloud are security and privacy issues, and various other types of regulations by the government. Governmental factors. Electronic Health Record Guidelines and Health Insurance Portability Accountability Act, or HIPAA, are two of the many ordinances that the government put into play to protect the privacy of others. It makes sure that organizations follow the laws and regulations so that they can remain in compliance. What type of technology is involved? Advanced data capabilities to inform innovative strategies, more immediate implementation and operational outcomes, better care coordination and delivery, cost effective HIT infrastructure, less burden from HIT infrastructure, and streamlined HIT delivery. Cloud computing in itself is not considered an application. Rather, it can be used as a host for primary storage and computing and houses numerous healthcare applications. Some examples of healthcare applications are electronic health records, data storage, telehealth and video conferencing, and clinical decision support systems.
How do we deliver the cloud through services? When choosing a vendor to deliver services, healthcare organizations, how may we acquire the cloud?
Who are the users? The users are the U.S. government, which this helps decrease the national healthcare costs, providers such as the hospital, medical practices, and nursing homes, Insurance companies, where they have the capabilities of billing the providers for the services rendered for the patients. Pharmacies, where they have the ability to do e-scribing. And of course, the patients. And it allows or empowers them to take full access or gain access to the electronic medical records. Laboratories also have the capabilities of using this so that they can also transfer lab results to the providers or if the patients want to see them themselves. What do they think of the cloud? The cloud has slowly made improvements on accessibility of patients' records to providers and to the patients, including the workflow operations within practices and skilled nursing facilities, such as the nursing homes, hospitals, and assisted living. It provides an infrastructure that allows hospitals and medical practices to improve computing resources at lower capital outlays. How does the cloud impact the patient? The cloud offers flexibility, interoperability, and most of all, progress. Care coordination also offers the patient health information to be shared by various healthcare facilities, clinical practitioners, and others in order to facilitate a quick and quality patient treatments. The capability of the cloud can allow for providers to provide better and commendable services to the patient, and it also empowers the patient to be proactive in their care.
How is value assigned to the use of the cloud?
Healthcare information has solved the problem of patient centricity. Cloud has bridged all of the challenges, hence giving healthcare institutions an invaluable opportunity for better services for the clients and patients